So welcome everyone in today's clinical meet. This is our sixth edition, and the first case study that we are going to see today is presented by Dr. Neema Sitapara. She is an eminent pediatric. She practices in Gujarat, Rajkot. And ma'am, you may start with your slide presentation.
Okay.
You're the
I
co-host.
thank AoH for giving me this opportunity to present my little experience about using hypnosis in my pediatric and adolescent practice. Is my screen visible?
Yes, ma'am.
Okay.
Yes.
I'm starting the slideshow.
Please.
Yes. So today I'm going to present a case of an adolescent where the diagnostic dilemma started with appendicitis, then it ended to anxiety, and then the last part, which was challenging, was regulating the affect. So how this presented? She was Riya, 16 years old female, a standard 10 student, and she came to me in 2021. So that was the time of COVID lockdown and the schools were online. Actually, she was referred to me by a psychiatrist for counseling. The whole story had started before 3 months when she presented almost all of a sudden with intense vomiting, and that vomiting required hospitalization by a physician. Even after 1 or 2 days of hospitalization and routine investigations, the vomiting and also the weight loss started and it persisted. So she was referred to surgeon because usually when there is some GI symptoms that are not explained otherwise, that little appendix in the tummy is blamed for the symptoms, and considering appendicitis, she was referred to the surgeon. He requested for a CT abdomen, which again was non-specific. Meanwhile, the parents were very anxious because 2 weeks had passed. She was not able to attend the school and the symptoms continued. They went to gastroenterologist and upper GI scopy was done. It was again negative. Vomiting, anorexia, and weight loss continued. Then they consulted a neurophysician. MRI brain was done considering some CNS pathology, brain tumor or something like that. Again, that came normal. The neurophysician referred the patient to a psychiatrist saying that there is some mental issue with the child and he needs some psychiatric treatment. The psychiatrist gave mild anxiolytics and he suspected something psychosomatic and functional issues. And this is how he talked to me and he referred Riya to me. So this was the long presentation of Riya coming to me. Now, whenever we deal with an adolescent in the primary OPD, we just comfort them and we give them an appointment for a screening session because it needs a lot of time and patience and empathy and connection with the child to explore the underlying issues that may be causing the psychosomatic symptom. So this is the things we follow when we deal with an adolescent. It is known as head screening. There are criterias. Shortly, I will explain the criterias which we explore. Home, like what is the family, the child is connected to the family member with whom she is comfortable. Are there any issues going on in the family? Regarding the education of the child, how she is getting along, is there any fears, issues with the friends, bullying, eating, is there any change in the eating pattern, how she feels about her weight and her body image, activities like how she spares time, her activity with gadgets, with online or social platforms, history about any drugs or any tobacco or alcohol if she is taking, or she is in a group of friends who are consuming such substances. Regarding sexuality, how bad she feels sometimes, and is there any ideation of suicide, and about her safety, like risky driving or her passion about taking risky selfies or something like that. So risk taking behavior also we explore. Whatever we do, it is in a very comforting manner, non-judgmental manner. We don't ask direct leading questions, indirect questions, creating rapport and exploring these areas with the adolescent is first session is very difficult one, but once you get to connect with the child, you get lots of information from the child. So we did a separate session with the parents, and from the parents we got the information that Riya had been angry since 3 to 4 months. Often she was sad. School performance had deteriorated. She was busy with online indulgences, and most of her activities were secret from the parents. Sometimes she behaved stubborn, and she was not eating well at home. The mother particularly said कि वो बाहर friends के साथ जाती है तब खा लेती है, घर में खाना नहीं खाती है. So our confusion is, are these complaints just an adolescent mood swing, or is there something else going on that is a serious disorder? Of course, this is a serious disorder because her weight, her vomiting, not eating well, her schooling has been affected. So we cannot simply tell this as a mood disorder. Now, when we talked with Riya, the positive things which we get from the history and details interaction with her was she wished to become a lawyer. Her maternal side, her nana and mama were famous lawyers in the city. There was history of frequent parental conflicts, and mother was short-tempered. She used to intervene between the fights of the parents, mother and father. Online mischiefs with friends were quite common because they were bored with the COVID and online studies. And during one such incident, she became a scapegoat. Actually, they were a group of 5 friends who were making some obscene pictures of the teachers, like some morphed images, and one of the friend leaked this image, and that image got to the school. The teacher got that image, and the school principal intervened, and other friends escaped, saying that Riya was the person who had started this. So she became the scapegoat, and she was suspended for 1 week from the school. There was threat, humiliation. Even the mother spanked her for this incident. And after this, the first episode of vomiting started. So we can coincide the first episode of vomiting with this issue. This issue was never revealed by the parents. They never mentioned about this issue. So she was not able to eat when she remembers particular words from the mother. उसकी मदर ने उसे बोला था कि तू पैदा होते ही मर जाती तो अच्छा होता, तू हमारे घर में ब्लैक शीप है. तो that words she got into her mind and her heart, and she was not able to eat when she went home and saw her mother. Episodes of insomnia, panic attacks, they all started. So when we explored the feelings that Riya was nurturing, it was a mixed feelings of hurt, shame, anger with the friends, being betrayed by the friends, rejection, resentment, lots of guilt. Why did I do this? And helplessness. So she was nurturing a mixed bag of feelings. Why teens are vulnerable? Because they have an immature neurobiology. Their stress response is not as mature as us of adults. They are highly pulled by experimentation, impulsivity, rapid physical and sexual changes going on. Peer influence is high. The coping skills are very poor. The stress response is also underdeveloped. So they may get like a stress storm. The chemicals are also secreted for a long time, and there is a huge bout of the chemicals causing actually a stress storm. Digital media exposures, and sometimes the parents are ignorant. They are not capable of handling such issues. There are social stigmas. That's why the parents never revealed about this incident to any of the doctors they have consulted. Had they done it, she would have been saved earlier, and so many investigations would have been saved. And there may be denial also. They would say that no, that is not the reason of the problem. There is something else the doctors are missing. So the management plan we made was first the session with the parents, like how the mind body interface, how the symptoms of mind are expressed through bodily symptoms, adolescent behaviors, and parenting styles. How can they help Riya when she's facing such frustrated moments? When we did first session with Riya, she was given understanding about the issue that she is facing. Relaxation technique was taught to her. This reduced the vomiting, and she just started feeling the nauseating sensation. After the second session, when suggestions for GI healing and ego strengthening were given, vomiting almost stopped, and anxiety and insomnia also resolved. She said that she could sleep well, and her panic attacks also resolved. But the anorexia and feeling hatred for mother continued. Like she said that I cannot get rid of that words that my mother spoke on that day, and I get a lumpy feeling in the abdomen when I enter home and I don't feel like eating. So this was the challenge. Now, how to make that Gathbandhan between the daughter and the mother? So when we explored further about her likings to find some connection with her mother, she said that her mother actually wanted to become a lawyer. That was the dream of her nana, and but she couldn't do that because of some social circumstances. And her mother had always wished that Riya becomes a lawyer and fulfills her dream. So this was the connection that we found, that it might be helping Riya. And so a session of trance with guided imagination of her becoming a lawyer and getting the convocation, the degree of the lawyer. Her mother coming up on the stage, hugging her and feeling proud that the dream which she nourished had been completed by her daughter. So post hypnotic cue was also given that every time she comes home, she remembers her mother's new statement, new words, and the new effect associated with it. So I don't know what to call this or what to name this technique as. We can call it SIC, sensory imagery conditioning, or whether age progression also I leave up to the seniors and experts in our meet. But it worked. So this is the ultimate result we got. I got a feedback from mother after a couple of days that Riya had started eating at home. And today she told to me that Mama, मैं चाय बनाती हूँ, तू मैगी बना. It was her favorite food, chai or Maggie. And the mother was so happy that something has changed Riya and she has started eating at home. So I think this was a wonderful transformation about her feelings with her mother that was resulted because of this wonderful tool of hypnosis. So what experiences we face, physical symptoms we face, we should remember that they have roots in the mind and also the body, and thoughts and feelings are just powerful triggers both for disease and ease well. So the same thoughts and feelings were causing discomfort to her. The moment we were able to manage the thoughts and feelings, she started feeling the ease. And treating teens is complete only when we get into their heads and heart, not just by physical symptoms and physical investigations. And psychosocial screening should be a routine process, as routine as other investigations. We make a list of radiological and blood investigations. And so this is the story when we made friendship between the heart and brain of a teenager, and we helped her to heal. And as healer, we should also remember that being a healer is about providing people with the tools they need to heal themselves. We are just providing them tools. They heal themselves. So we should not forget to congratulate the children and the teens that you have done a wonderful job on yourself, and it is actually you who have healed yourself. So I thank you. I thank once again the AoH for giving me this opportunity to share my small experience with using hypnosis along with my adolescent counseling techniques. Thank you so much.
Very good. बहुत अच्छा case, बहुत अच्छा presentation, Neema.
Thank you, sir.
Wonderful. I'm very happy. Good. Comments, sir, I think. And maybe I need to leave now, actually. Prashanta, excuse me, and we leave.
Neema Ben, excellent presentation.
Thank you, sir.
I tell you, this is what all the medical doctors need to understand, that just going for investigation or before going for investigation, at least give little more time to your patient to take some history, whether any problems which they come across are psychosomatic or not. So I think we should go on propagating this kind of cases more to the medical fraternity, and if any chance to present it or even publish it in any medical journals or something, that we should not leave that chance to go for. Very nice, very good, and very
Thank you,
well
sir.
analyzed and excellently done, Neema Ben. Excellent.
Thank you, sir.
So, congratulations, Dr. Neema. It was an excellent presentation. Do we have any other questions from the audience that we can take up?
She has not left any stone unturned, which
Yes.
can lead to ask her any question.
Yes.
Very well
Thank you so
detailed
much, sir.
history,
Yes,
and
yes.
very, very systematic and meticulous.
Yeah, I have actually at the outset I want to congratulate you, madam, Dr. Neema madam. You have done a very wonderful presentation and a very commendable work you have done. Only one actually I want to know, how many sessions you have conducted?
Sir, primarily 3 sessions were there. First
Okay.
session was about repo and screening, like getting all the details and exploring the feelings which she nurtured.
Okay,
Then
madam.
the second session was giving her relaxation techniques and
Okay.
understanding about how the mind and body are connected and how the symptoms have started. So the moment she realized that, okay, this is connected with my feelings, she felt that, yes, I think now I can manage the problem which I am having. So mostly that part we can call it as CBT or something like that.
Okay.
And then third session, we gave her positive suggestions for GI healing, for healthy appetite and digestion and all the GI activities, and ego strengthening also.
Okay,
So
madam.
3 sessions, she was almost okay. But
Okay.
that part of her not feeling well with the mother and getting anorexia and lumpy feeling when she enters home and not wishing to eat at home, that was the last part which needed actual work, and for which I had to really plan out something and find out some connection and prepare a session of trance. So when we say our knowledge of clinical hypnosis came into help in that last session.
Correct, madam. Actually, in your presentation, you have mentioned about this age progression also. Whether you have conducted a separate session for
No, sir.
giving
No,
this age progression.
this was the one session of
Okay.
typical clinical hypnosis.
Okay,
So
madam.
it was my view itself that should we call a sensory imagery conditioning where her
Okay.
affect was changed, or can we call it age progression also? Because we did the work of age progression also. We just gave her imagination that she has completed her lawyer and her mother is
Yes, yes.
congratulating. So whatever we label, but the thing has worked.
Okay, okay, madam. Thank you very much. Thank you very much. Over to
Thank
others.
you, sir.
Thank you.
Ma'am, I think I would like to ask Dr. Prasanto, sir, would we call it CBT or psychoeducation?
We'll not call it CBT because CBT needs at least 8 or 10 sessions of program, but the cognitive restructuring component was there. So would be more appropriate to call it cognitive
As cognitive
restructuring
Yes, sir.
to focus on this
Okay.
particular aspect. So that would be more helpful.
Okay.
Madam, I would like to ask one thing about this SIP or the age progression that you gave. What is the possibility? For example, I'm creating a imagery where there is a completion and that completion is being rewarded from the significant person.
Yes.
And I'm coming with this kind of expectation. When actually I'm completing, my expectation is not getting fulfilled in reality. Whether this can create some conflict
in future
within the child.
Yeah, later on, if that is not validated later on.
In case it changes her mind and she does not want to study law in future, so will it create a situation of conflict within her?
It may create. It may create.
So I was thinking when ma'am was explaining this, like if we do say imagery, guided imagery visualization, and say white light visualization, in which we say your body and mind is becoming more and more stronger. So the ego strengthening instructions that we give for cognitive restructuring, would that have also worked equally well in this case, rather than giving a futuristic model which may or may not come true in future? Prasanta sir?
I don't know. Madam has tried to connect the heart with this particular issue, and because of the emotional significance of that experience, obviously visualization would be more helpful for that particular child. But when we go for white light visualization, that is not that much associated with emotion. So the progress might be a bit slow. It might work, it might not work. So whenever there is something emotionally arousing, and that can be quite fruitful. At the same time, if it doesn't match, it can also create a problem. So sometimes metaphorical issues, addressing, taking some metaphor probably is helpful in some situation, because we don't know whether something is going to happen or not. So metaphor can take care of it. So that is one thing. And second is, if we do not give a direct suggestion, okay, you imagine this, rather in the age progression, if we suggest them to imagine, free imagination in age progression, like, okay, 2024, 25, you are there, just imagine what is happening. So there probably it would be less conflicting.
Less conflicting, yes, sir.
Yeah.
Yes, sir.
Yeah. So there are multiple ways to address even therapy models, various ways.
Yes, optimism is very much helpful. Creating optimism is very much helpful. But now, if you see some of the articles, they are talking about optimism itself can work as a defense mechanism, defensive optimism they are talking about. There are some people who use optimism as a defense. So to some extent, it can be helpful, but sometimes it can create problem. But some other individual, it might be really helpful. So we need to probably do the follow-up with the particular client. If there is any kind of mismatch, or we need to prepare that particular client so that the client, we need to work with the for the coping skill enhancement of the client. So if there is any kind of mismatch or conflict, the client is able to manage that without much problem, or immediately can seek the therapist help so that the severity can be addressed. So thank you, madam. It's a insightful case, and thank you.
Yes.
Being a pediatrician, you thought about addressing the psychological conflict the child had.
Thank you, sir.
I also have one perspective here.
Yes, ma'am.
See, the key point here is the child was hurt because of a negative comment by the mother. And in the visualization, you have provided a positive comment to the subconscious.
Yes, ma'am.
It is perhaps not the goal achievement which is bringing her the relaxation. It is the positive perception of herself in the eyes of the mother.
Mother.
So future visualization techniques actually work. They are very effective in cognitive restructuring also. When a person is able to visualize a scenario which is different from the current scenario, something which is changing, and that change itself brings in the motivation at the subconscious level also. So I would say your case and the success of the case is based in future visualization session that was conducted by me.
Okay.
So congratulations to you. And for other sessions also, whenever we are considering future visualization, it is really helpful if we have a specific goal, but not a generalized one. Because it is that specificity which is enough for bringing a counter to the present conflict. Just that. Thank you so much.
Thank you, ma'am.
Yeah, thank you, Veena ma'am, for bringing in light the concept of age regression and goal specificity. I'm sure it will be helpful for all of us.